Talking with Dr. Hal Huggins today, and you're speaking at the Health Freedom Expo about root canals and toxicity. First of all, talk about what root canals are and why people need them.
Boy, that's a good question. I mean, I know what a root canal is, but why people need them, that part I'm not sure I can answer. Due to the studies that I have done for the last 15 years. What is a root canal? A root canal is where you take a tooth and you drill a hole in the center of it. And you go in and there's a chamber, the pulp chamber. That's where the nerves and blood vessels and all are. You can take a thing like a little rat-tailed file and you go up and down in that and clean out the canal. And then you fill it up with wax. And there are all kinds of things that tell about sterilization of the canal. And some of these things kind of go against the basic principles of physics. For instance, if you heat wax, it expands. When it cools, it contracts. When you push it down, it's kind of like bread dough. You used to make bread, didn't you?
Mm-hmm.
No, maybe not. You push bread dough down, you let go, and it springs back. Well, what you do is heat up this wax, put it in the canal, take a hot instrument that's been on a flame, and shove it down in there too. So you push the wax as far as you can and hope it doesn't go through the end. But you can't see the end, so you don't know whether it did or not until you x-ray afterwards. But when you let go, it springs back, and when it cools, it shrinks, leaving 36% shrinkage around the wax. And that's quite enough space for bacteria to get up into. So the bacteria, you got an infected tooth, or you probably wouldn't be doing a root canal. But the bacteria come up here, and then what makes the sterilization difficult is that there are tubules that go out from the canal to the outer portion of the tooth, which is called the periodontal ligament, which you can probably see on this slide because it says periodontal ligament. Well, if you tie all of these tubes together, it turns out to be 3.5 miles long just in a single front tooth. That's a long direction to go to think you can sterilize. But this is what you're taught in dental school. When we got into DNA, we began to find a few other things. And some of my research, I'm sorry to admit, was rather on the slow side. What we did was we'd take out a root canal tooth because we were finding that the root canal tooth seemed to be an initiating or at least a contributing factor to a lot of the diseases of, quote, unknown origin, unknown etiology. In other words, where's it coming from? So if we take this teeth out and examine the root, the bottom third down here, we found a whole lot of bacteria. And these are kind of dangerous bacteria. And then a year or two later, I decided if the bacteria are really coming through those tubules to the periodontal ligament, what does the ligament contain? So we would cut off the ligament and test that. But we found more bacteria in the ligament. Now, you can't get to that to sterilize it without taking the tooth out. And then, about 10 years later, I got the idea, what do you suppose is going on in the bone outside of the tooth? So we take the tooth out, and then you have to use a dental burr to cut out the ligament. A lot of dentists will just try to scrape it out with a little instrument that scrapes. And what that does is to push the bacteria into the bone, into the bloodstream. So if you do that, people get a whole lot sicker. All right, so we'd take the tooth out, take a burr, cut out the periodontal ligament, let it bleed for a little bit, and then take the blood sample there. We found a whole lot more bacteria. So sterilizing the tooth is something that is not only impossible, but it can't be done. So what we do now is then we found, now blood chemistry is my primary field. So what I do is look at the blood chemistry before and after these procedures to see what's happening in the immune system. I have a postdoc master's that emphasized immunology. So we look at the immune system, we look at the endocrine system, we look at cardiovascular, look at all these systems to see if things got better or worse. Well, in taking the tooth out, sometimes some of the chemistries that I follow, the blood chemistries, would go down, and 4 months later they'd come back and approach where they were supposed to be. Okay, this is nice. But then we found that if we take the tooth out, cut out the ligament, let it bleed for 5 minutes. I mean, you don't need a transfusion. You may be losing maybe a teaspoon of blood, so that's not real dangerous, but it's real safe. Because what it does is to bring the bacteria, flush the bacteria out of the bone. And then we found our changes in 6 days instead of 4 months. So where is the real problem with the root canal? It's around the tooth in the surrounding bone. Our research now is trying to see how far into the bone the bacterial infection goes, but it's at least 1/4 of an inch, which in the mouth is, you know, 1/4 of a mile. It's a long distance. And
When you talk about the dangers of root canals that have happened over many, many years, are there safer alternatives now if we're in a position where we need something like that, where we have a dead tooth?
Very definitely, yeah. I'm giving a talk in a few months called Advance to the Rear, because in the past there was a technology that took care of those problems. It was called extraction. I mean, if you've got a ruptured appendix, you're going to fill it with wax and put a gold crown on it? You got the same bacteria there, only the ones in the mouth may be worse. You remove it. Question is, do all root canal teeth have to be removed? And the answer is no, only in those people who are interested in their health. If they're interested in their health, they can do what we did 50 years ago. Take the tooth out. Only dentists are taught to leave the membrane, the periodontal ligament, in place, in the bone, which is like delivering a baby and leaving the placenta in. Not good. But if you do it properly, if there are a series of procedures that need to be done, you don't just take hold of it and yank it out. A few other procedures, because as soon as the dentist touches the tooth with cold steel, which means the forceps, bacteria in the bloodstream going where? Every place blood goes. You poke your finger, you get blood. Big toe, you get blood. So it can go anywhere and everywhere, and does. But the bacteria have something called chemotaxis. It's a magnetic attraction, a fatal attraction, if you would, for specific tissues. Some bacteria like the heart, some like the liver, some like the lungs, some like the brain, but they have access to the whole body. I teach dentists how to do it without making those mistakes, and using the blood chemistry as a guide to how do you treat the patient. Is there a specific treatment? Yeah. From Tom, Dick, and Harry, we have 3 different treatments. Who tells me how to do it? Their blood.
When you talk about the bacteria in root canals, if somebody has a root canal, has that then tooth extracted, have you found that these people can recover? Does the bacteria, do you have to still treat that? And can people get improvement then from their conditions?
I think we've got 2 or 3 different questions involved in there. If they have a problem, then you take your blood test and your history and so on and find out what the problem is, where it comes from, because there are immunologic tests that you can do to find out what dental materials they're reacting to. So you kind of have to find out what the target is before you pull the trigger. Then if you just take the tooth out and do nothing more, by actual measurement, 63% of those people end up with another autoimmune disease they did not have before they had it removed. If he cuts out the periodontal ligament, which is where twice the number of bacteria live that are in the tooth, if he cleans out the periodontal ligament, he loses his license. Yeah. Explain that one. Yeah. So if it is done properly, then you can start putting the body back together. And that's where the blood chemistry tells you what you need to do to stimulate healing. Because just getting rid of the enemy does not restore the nervous system, the heart system, the kidney, the liver, none of this. All of that comes simultaneously or afterwards. But detoxification, it's okay, but it doesn't do a whole lot of good before the dental procedures are done. I had an illustrator in the practice who has the type of humor I like to see on paper. And he did illustration one time of a guy drying off while he's standing under the shower. This is detoxification while you still have root canals, cavitations, nickel crowns, implants, all these things in the mouth. So yes, if all these procedures are done, you can turn around a lot of the incurable diseases at a very high rate. But leave out one or two steps, it doesn't work. So it's very touchy.